Welcome to CareTalk. I'm David Williams, President of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
And John, I think we both agree that 2017 was not the greatest year from a healthcare policy standpoint. No. But I got to ask you, what was the worst of the worst, and what was the best thing that happened?
The best worst?
The best of the worst.
Best worst of worst?
Yes.
I mean, my view is the most ridiculous thing that happened this year was the unwillingness to fund Child Health Plus. 9 million children, everyone agrees they should be taken care of. And Orrin Hatch last week, the chairman of Senate Finance, after having demonstrated significant support for something that to take care of 9 million kids, is saying in the shadow of a tax cut for the richest people in America that we may not be able to find the money to take care of the kids. Appalling. Appalling.
All right, so Chip, that's a pretty bad one. That's a bad one. I got another bad one. The bad one for me...
Beat that one.
I'll try my best, okay, because this affects even more people. So the idea of saying, well, you can't repeal Obamacare, so let's actually try to sabotage it. Let's try to sabotage the exchanges. Mostly, the biggest one is by saying, we won't say whether we're going to have subsidies or not, whether that's a bailout. And that just creates uncertainties, which is supposed to be the opposite, what the Republicans are doing.
You're absolutely right. It's a tear it down versus build it up. This is a bit of a bizarre year. But I think that we'll have a better year in 2018.
But I want to hear what was the best or the worst, despite all the bad stuff. What happened that was a little better than that one?
Well, I think the only good thing about this year is that healthcare policy has turned into healthcare politics. And if you look at the Virginia election, rather, what you'll see is the #1 issue that drove the wave election, not just at the governor's level, but allowed the Democrats to take the House of Delegates, was healthcare. And I think you're going to see that one of the big drivers of this wave for the Democrats is an attack on the part of the Republicans, not a desire to reform, but a desire to destroy care for vulnerable populations. And that's really good news, that people are standing up and fighting for their health care.
I think even, John, another example, and my favorite one of the year is actually in Maine. With a ballot resolution, which wasn't necessarily a Democrat versus a Republican. It was the people saying, hey, we're a rural state, we're not a very wealthy state, and a lot of people rely on Medicaid. Why wouldn't we take the Medicaid expansion? And it just rose above politics, just sort of common sense that people at Maine and other places are known for and voted for. Well, I think that was my high point.
And it's complicated, right? And yet it turned into a ballot. I think that maybe the one thing we can agree on this year is that democracy works. For healthcare in particular. So David, who should be afraid of Amazon?
Well, I think everybody is afraid of Amazon, or at least talking like they're afraid. I mean, Amazon has come in.
I'm not afraid. I'm kind of looking forward to it.
Okay. Well, they have come in and really trashed some other industries, which put them right out of business that didn't take them seriously enough. But I think that what's happening now is that healthcare, which is a much more complicated place for Amazon to get into, they're being unnecessarily scared. And what I think they're doing is some of these mergers are coming together, and everybody will get so tangled up and screw themselves up that Amazon maybe they'll just be able to walk in.
Now you're critical of people reacting to innovation. I actually think the Aetna-CVS merger is a really exciting vertical merger. And while people are very focused on the merger, if you think about what they've talked about, taking care to the home, delivering care in the community, personalizing and combining care and service, it's actually kind of exciting. I actually think that, I agree with you that people should...
Are we talking about Amazon or CVS? I get confused.
I think that Amazon is a force for good. Okay. I think that the Aetna-CVS thing, not all mergers are bad, David. So,
okay. I think the Amazon, you can definitely come in and CVS should be quaking in its boots on what happens with the pharmacy business. Okay, even though that's a tough business, but that's where Amazon could compete. I think more interesting is what happens with Alexa and say, Alexa, get me some health care.
Oh, that's going to work really well. You might want to be more precise. I think that there will definitely be an impact on retail. But you really haven't developed your thought. But there's an interesting idea there where you start to automate a lot of the tasks in healthcare. And what's exciting about Amazon coming into healthcare is they are not boundary constrained around innovation the way you are around complexity and the way things have been done in the past. They're really about building new models, and I think there'll be two great things that'll happen. Old models will adapt because of that threat, and new models will emerge. I don't think people should be afraid of Amazon. I think they should be embracing it.
Great. Well, I'm a good Amazon customer, and I'm going to ask Alexa what she thinks about your opinion when I get home.
So, David, what about all these hospital mergers? Is that good thing, bad thing? Do we care?
I don't know. I mean, John, the hospital is sort of like the center of the universe, and everyone talks about hospitals, this big building. When you go into some small city and you thought, oh, this is a depressed city, and you go in and see like, oh, well, there's a big new building there. Must be a hospital, and you're almost always correct.
But that's a function simply of the way healthcare has been funded, and the way, frankly, for the last couple hundred years, people have looked at healthcare. I think that do you really think these hospital mergers matter?
I think it's certainly grabbing up the headlines. Having just been in a hospital, though, I was really ready to go home, and I think there's much better care available in the home and fewer dangers to the patient once you're out of the immediate need for life-sustaining support. So hospital mergers, it certainly gets a lot of attention. It's certainly they're reacting. They're trying to they're facing threats.
What do they get out of the
I
merger?
mean, maybe more bargaining power with the insurers, maybe ways to hopefully cut costs, or just maybe one executive wants to exit, so it's a good opportunity.
I think it's a sideshow. I think that the hospital mergers are irrelevant. Innovation is happening outside of the hospitals or inside individual hospitals. I don't think it matters.
So, John, we agreed 2017, kind of a write-off. I don't know if you can deduct that from your taxes this year or not.
Not anymore.
But what about 2018? Is there hope?
Oh, there's always hope.
Keep hope alive.
I think that the 2018, you're going to see an inevitable reaction to the action of people fighting for their benefits. And what's going to happen is
like a physics lesson.
An emergence, well, perhaps for you. What you're going to see is I think the Republicans are going to engage around real reform. We saw in the Cures Act and with MACRA a lot of really good bipartisan work once there was a calm between attack on Obamacare 1 versus attack on Obamacare and everything else 2. I think the Republicans will come together with Democrats, and we'll start to see a return to value and innovation, which is kind of where we left it during the President Obama and his health care reform agenda.
So, I mean, 2017 may seem like an election year with all these highly contested special elections, but let me remind you that 2018, unless the president is changing the dates around, is an election year. And I just don't see bipartisanship emerging in 2018. But I think that you may actually see some of the things less on the policy side and more just in the implementation side. So while all this nonsense that's been happening with policy, things like big data have been moving forward, and maybe we'll start to see some of the real impact of it.
Big data, what does that mean?
How big is it?
Well, it's not really the big data. It's what you do with it in a small way that matters every day. And I think you're going to see, I talk less about the headline around artificial intelligence and big data and more about how can I use information to improve service and care every day. That's what's going to be really relevant about data. It's not going to be that data is big. It's going to be the data is relevant.
So maybe what we're also going to see is a continuation of the sort of broad people power. So if you think about immigration as another example, and instead of thinking about this guy coming here is chain migration is going to be threatening to us, you may think, hey, how come my pharmacy is closing at 6 p.m. instead of 10 p.m. because the pharmacist was
one out of every 5 employees in healthcare is an immigrant, and you put up walls, you shut down doors, you shut those gates. Healthcare is going to be less available, and there are going to be fewer caregivers. It's insane.
All right. John, are you ready for the lightning round?
I am.
John, lightning struck in Alabama this month in the special election. Do you think it has broader implications, or is it just a one-off?
There's no question that when you have a party that takes on all women, all young people, all people of color, and anyone who's moderate to progressive, they're going to lose. The Republican strategy is
especially if they run a pervert.
They will continue to lose. Well stated.
I think it's, even if it's just a one-off, it has some real impact. I mean, the first thing that Senator-elect Jones called for was the CHIP reauthorization, which you talked about before. And now I think it's going to make it much harder to repeal Obamacare in 2018.
TikTok, Apple Watch, what say you?
I mean, you know what? It's a failed product. This is a watch. You want to see a watch? That's a $7 watch, not a $7,000 watch or whatever Apple charges. It's
like healthcare, you were locked in the past.
It's a failed product, And I think they said, what
product.
could we do with it? We'll make it a healthcare thing. Those are overpriced and don't work that well. So I think that's the Apple Watch in healthcare for you.
You're the kind of person who would have been skeptical of the first computer because it didn't do everything. Apple Watch is the first stage of wearables. People are embracing wearables. They love feedback. They react to feedback. It's going to be woven into everything we do in healthcare. You're wrong.
So I think it's just kind of an accessory, and I think I accessorize pretty well, John. Now,
embrace the future, dude.
I would say, okay.
Lovely hat.
You embrace the future. What's your healthcare hope for 2018? Give me some hope.
Well, I think that the biggest hope I would have is that the drug industry would come and work with government with a proposal that would protect the high margin and the high prices that we need to pay.
I'm sure they'd be willing to do that.
Yeah, exactly. And also for the 80% of the drugs that are not in those categories, start to keep the price the same or reduce prices over time. That's my sort of holiday hope.
Well, that's a big one. Mine is a little more specific. I was always hoping for one of those tricorders, like from Star Trek, and I didn't get one last year.
You with the watch? You're looking for Star Trek?
I'm waiting to upgrade. I have a long upgrade cycle. But I hope to have one of those, and I have seen some things like that are able to listen to your breathing or to your coughing and to diagnose your illness. So I think maybe we're going to be there for next year. That's my. Don't shake your head at my hope.
I'm talking about drug prices, which we can have an impact on, and you're leaning into Star Trek.
Yeah, well, I guess
good luck with that.
We'll end the year where we started it with our disagreement. Thanks for joining us for yet another edition of CareTalk. I hope that you will subscribe so that you can continue watching and listening to CareTalk in 2018. I'm David Williams from the Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Happy New Year.